The world of questioning, inquiry. Inquiring is an integral part of full diagnostic methods. The Huangdi's Inner Classical Medicine says, when making a diagnosis, if not asking for the situation when the disease attacks, whether the patient has suffered from spiritual worries, incontinent drinking and eating, abnormal activities in the daily life, or poison, but just examine the pulse on the wrist in a haste, how can the doctors make a diagnosis? That underlies how important it is for a TCM doctor to first inquire into a patient's background, lifestyle, and exposure to disease. If such questions are not asked, the doctor cannot make an informed diagnosis. Inquiry is a key method of collecting medical information collection. Through this process, a doctor systematically collects information about the patient and the medical problems they are experiencing. This is done by questioning the patient and other relevant people. The quality of the collected information, especially its preciseness and completeness, has a great impact on the quality of the diagnosis and the effectiveness of any subsequent treatment. The four diagnostic methods, observation, listening and smelling, inquiry, and pulse taking, help TCM doctors collect information in a wide variety of ways. Observation, listening and smelling, and pulse taking are ways to get information using the senses. Inquiry relies on information obtained by talking to the patient. In a TCM diagnosis, the concept of syndrome or pattern includes a patient's symptoms and physical signs. These might include a pale face, a sore throat, a red tongue, and a quickened pulse. The word symptom is used to refer to what the patient feels, including disorders and pains such as headaches, tinnitus, suppression in the chest, or abdominal distension. As symptoms are subjective feelings in the patient, they can only be assessed by inquiry with the patient. Inquiry can help the doctor acquire a lot of other information that may be relevant to a patient's condition. These include details of their daily life, working environment, drinking and eating habits. Such information cannot be acquired using the other three diagnostic methods. What's more, when a doctor is assessing abnormal physical signs, he or she can use inquiry to find out about how a patient's conditions has changed over time. This extra information helps the TCM practitioner better understand the nature of the patient's disease and the abundance or decline of their qi. This can then be used to help make an effective treatment plan. You can see inquiry in action whenever a doctor asks their patient, "What's wrong with you?" In TCM, this question is used to elicit a patient's chief complaint. The chief complaint refers to the subjective statements made by a patient to describe their most significant or serious symptoms. These are the things that have caused him or her to seek medical help. For example, the statement that "I have had fever for a day" is a simple and a complete chief complaint. The chief complaint normally encapsulates the patient's main concerns and includes one or two key symptoms. The chief complaint has important value for diagnosis and offers important clues for the doctor to analyze, clues from which he can attempt to identify the disease. What other questions do TCM practitioners ask? Over generations, the frequently asked questions can be summarized as 10. These 10 questions have been carefully followed and are still used to this day. The content of 10 questions include the following advice. The content of 10 questions includes the following advice. The first question is to ask whether the patient has a cold or fever. The second question is to ask whether the patient's sweating. The second question is to ask about the patient's sweat. The third question is to ask about the head and body of the patient. The fourth question is to ask about the ejections of the patient. The fifth question is to ask about how the patient is eating and drinking. The sixth question is about how the patient's chest and abdomen are feeling. The seventh and eighth questions are to inquire into deafness and thirst. And the ninth and 10th question are to ask about old illnesses and their causes. Then the doctor should prescribe medicine to the patient and examine changes in the disease. If the patient is a woman, the doctor should ask about the menstruation. It is possible for the menstruation to discharge earlier, lack, cease, or flood. There is also a reminder about pediatrics. Inquiry is normally the first step of a diagnosis and plays a leading role in any subsequent investigations. Information at the fingertips, pulse examination. The saying, 3 fingers decide the heaven and the earth, refers to the diagnostic technique of pulse examination. This is one of the 4 diagnostic methods. It is an important way for TCM doctors to identify disease and is a proprietary skill for those who practice Chinese medicine. TCM examines a patient's pulse to see whether it is fast, slow, strong, weak, deep, or shallow. This is known as finding the pulse condition. The pulse condition is closely related to qi and blood of the viscera. The heart sends blood to the vessels, and this is what causes the pulse. For TCM practitioners, the pulse condition is related to the functional activities of the blood, the lungs, spleen, liver, and kidneys. This is because it is thought that blood circulation in the vessels is coordinated by the viscera as well as by the heart. In particular, the compression of lung qi is an important driving force that spreads the blood over the body. The blood vessels are thought to all converge in the lungs. The spleen and stomach are the sources of qi and blood. The spleen governs the blood circulation, therefore depends on the control of the spleen qi. The liver stores blood and governs the free movement. It adjusts the volume of blood in circulation. The kidney stores essence that changes into qi. This essence is one of the material foundations of blood. Experienced TCM doctors can precisely judge the location and the nature of a disease by examining the pulse. They can also use this technique to predict the development and the prognosis of a disease and to learn about the status of evil qi and healthy qi, and the abundance or decline of qi. In the early days, the pulse-taking method was complex and required a doctor to take a patient's pulse in the head, hand, foot, and a number of other places. It was gradually simplified to only require the examination of pulse in the wrist. To do a pulse examination, a doctor puts the fingers of their right hand on the patient's wrist pulse point. This is at the top of the forearm, just behind the outer side of the thumb, at the point where the radial artery is close to surface. There is a saying, pulse examination is to feel the pulse on the wrist, which sums up the current scope of the method. TCM theory believes that the abundance or decline of visceral, qi and blood can be reflected by the condition of the wrist pulse. Doctors of all generations have discussed the wrist pulse at length. They divide the area over the radial artery into cun, guan, and chi. These 3 points on the right wrist reflect the conditions of the lung, the spleen, and the stomach, and the kidney. In the TCM, the right kidney is called the vital gate, 命门. The equivalent points on the left wrist are where the pulses of the heart, liver, and kidney, and the bladders are felt. These 3 points are a window onto the condition of the viscera. The functions of the pulse condition is closely related to the conditions of the viscera and the qi and the blood. When the viscera, qi or blood, suffer from illness, the blood circulation will be affected and the pulse condition will change accordingly. This change is related to the location and the nature of the diseases. It is also related to the abundance or decline of qi. When a disease is located on the surface, the pulse is floating. If the disease is located in the interior, the pulse is deep. If the disease nature is cold, the pulse is retarded. If its nature is heat, the pulse is rapid. When the evil qi is strong, the pulse is strong. If the healthy qi is weak, the pulse is weak. In the Chinese ancient mythological novel Journey to the West, Monkey King, Sun Wukong, and the Buddhist monk Xuan Zang reach Zhuzi Kingdom on their journey to the western regions to obtain sacred texts, sutras. When they arrive, they find that the king of the Zhuzi Kingdom has posted a royal proclamation asking for a medical expert. Sun Wukong volunteered and tears off the proclamation. When the king meets Wukong, he is scared by the weird look of the Monkey King and retreats to his inner palace. Then Wukong says he can take the king's pulse by hanging 3 threads on the king's wrist, and by then feeding the ends of the thread with his fingers, while the king remains safely hidden behind the screen. This he does, and prescribes the king a Wu Jin pill, which completely heals him. The description of this diagnosis is quite wonderful and reflects the author's attainments in medicine. It describes how Wukong analyzes the pulse and describes the king's symptoms and the relationship of his illness to his viscera. Sun Wukong is just a character in a novel, and no modern doctors have these skills. But were the 3 threads methods of examining a pulse ever anything more than a story? It is said that such hanging thread examinations may have happened, but only to preserve the dignity of our royal patients. We think that doctors in ancient times, when called upon to treat empresses or imperial concubines, would have got full details about their patient from their eunuch servants. This would have allowed them to make their diagnosis before they actually met their royal patients. When it came to the pulse examination, they would use a hanging thread method and keep silent to show their respect for the imperial family. We also know from other sources that imperial physicians relied on the basic skills of the four diagnostic methods, so it is difficult to say for certain whether the three threads method ever really existed.